Dr. Oliver Bernath, the Chief Executive of Integrated Health Partners, which works with GPs to provide healthcare more efficiently and which backs the reforms. Also here is Andrew Porter, the political editor of the Daily Telegraph. Jed, it's nice to see you. Thank you very much for coming in. Doctor, as I see it, this is not really an ideological dispute. It's about managerial efficiency. Why do you back Mr. Lansley?
If we can treat patients better and make the NHS fit for the future, it must be a good thing. I think the fundamental direction that he's travelling in giving more responsibility for the design of healthcare to the frontline staff has already been started under the last government. Therefore, he's going in the same direction more forcefully as before, and I think that's correct. So if frontline staff, the doctors and nurses, can determine how patient care should look like, it must be right, and I think that's what is under debate. When it gets sidetracked into more ideological situation, more political things, I think we start losing the bigger picture, and I think we should believe that genuinely we all want to have a better NHS. We all have children, we all have parents, we ourselves may become patients. So I agree with you, we should discuss much more how it's being done rather than surmising that somebody else wants to undermine the NHS as such.
Andy, what about the politics of all this? I listened to Lansley today, and what I thought I heard was the application of the old handbrake and some screeching as the car shuddered to a halt. Did you see it that way?
Indeed, you heard correctly, Jeff. There was no question that the handbrake has been applied, and it's probably David Cameron who was leant across and grabbed that and put it on, because what we've seen since last July when these reforms were first announced, and it was a huge surprise if you go back to last July, people were looking at the coalition agreement. There was this line here about no top-down reorganisation, and there was Andrew Lansley coming out with this sort of sweeping reforms. And it was interesting that for many years David Cameron, one of his prime objectives in opposition was to make sure the NHS was neutralised as an issue, which arguably he did. I think the polls showed it was about level pegging with Labour, and here he was coming out with these announcements. So what you saw from Andrew Lansley today was basically a failure of the last 9 months in which they've failed to convince people that this is the way ahead, this is where the NHS should be.
So you feel he's had the heavy hand of the Prime Minister on his shoulder?
I think so. I think it was noticeable that there wasn't too many cabinet ministers out there backing Andrew Lansley on the front bench. Normally there'll be a rally round if Labour are going to come hard on an issue, which they obviously were today. Wasn't many cabinet ministers there, and I think that illustrated that at number 10 there seems to be a fair bit of anger about what's happened here.
Dr. Bernath, what about these reforms? It seems to me they put a huge administrative burden on GPs. I think most patients would say, well, look, I want my GP to be my doctor. I don't want him to be a bureaucrat.
I entirely agree, and that's where I think I would also criticise the direction of the reforms, where they've probably been too heavy on the focus on commissioning. Doctors, myself included, have trained to look after patients, not to be insurance commissioners. Well, I wouldn't put it negatively. That's an important job to do, commissioning, but it's not one that doctors are trained or qualified to do. So I think there is some improvement to do. But the idea of having the frontline staff that creates the cost by doing the job also be accountable for it, I think is correct. That one has been pushed towards commissioning, I think it's a bit of an error. One should make the providers also responsible for how money is spent. Now that's, I think, where some listening has to be done.
Now, what about Cameron's promise, Andy, in the run-up to the election, that he would protect, in real terms, the NHS from any cuts? I was looking at the numbers before we came on air. Last year, the NHS budget was 122 billion. This year, it's 126 billion. Now, that's a 3.2% increase, with inflation running at 4.4%. He's kind of playing fast and loose with that, isn't he?
He is, and this has been one of the issues. When people have looked at the inflation figures, they knew this was going to come back and bite Cameron at some stage. I think what you saw was one of the interesting things Andrew Lansley said in the chamber today was that he did get it onto that argument about how much it's going to cost. And what he basically said was he used the phrase that unless we do these reforms, the NHS will not be able to continue. I think the phrase he used was on a sustainable course. So he's saying there, unless we do this, we're not going to have the money, and you won't be able to have that same NHS as you said, regardless of Cameron's rhetoric on being ring-fenced.
So Cameron is keeping his fingers crossed that the Bank of England gets that inflation rate down, because if it doesn't, his numbers are going to let him down.
They will, and at that stage, Labour will have a field day, there's no doubt about that.
What about just the nature, Doctor, of the NHS? I mean, it's a huge employer, the biggest in Britain, I believe. Isn't it always going to be a groaning bureaucracy, and we just have to put up with that?
To some extent, you're right. I mean, it's also a public service that has a very important good to us, health. So, of course, bureaucracy being the flip side of democracy and accountability we'll have to live with. I think it's important to simplify the system insofar as there must be more transparency, more local decision making, more involvement by the public and the patients locally. And if the local public and the patients are happy with what the local solution might be, then I think they should be left alone getting on with it. That reduces bureaucracy.
I mean, because in the end, nobody can say that Gordon Brown didn't throw money at the system. He definitely did. The budget was more than doubled, I think, over the course of Labour's tenure. That said, you know, a lot of people would argue the money was spent in vain. It was just wasted. Would you agree?
Sure. I mean, if you look at productivity figures in the NHS over the last several years, then productivity is certainly not improved. Many say actually declined by some percentage points. So I think the direction of travel is right to get to local decision making. My plea would be to make sure that you don't have a commissioner looking after the money and the provider do more, earn more system, because there you always drive the healthcare cost up and the whole supervision of the system becomes more bureaucratic and more expensive. So our plea is to make the provider responsible also for how money is being spent, and thereby to align the interest of the patients with that of the provider. So the provider should be financially also incentivized to keep a patient as well and healthy as possible to avoid expensive on-cost later down the road. If that's the case, then you've got everybody's incentive aligned and the whole need for control should be reduced on the bureaucratic sense, and I hope that would bring savings.
Andy, you want to come in here?
Yeah, I mean, on that point, that is where the failure of this policy has lain so far, and that is that the government haven't been able to sell this sort of huge bureaucracy that exists within the NHS and in abolishing PCTs and strategic health authorities. They needed to say what these people were, what they did, and that it could be done by GPs, and therefore you could save money. And that's where the failure, and that lies with Lansley, his junior ministers, you know, his vast reams of press officers and other communications experts that surround government departments. They failed abysmally here.
And Andy, where are the Lib Dems on all this, apart from sort of away from the scene of the crime?
Well, interestingly, I think later on this week you'll see Nick Clegg, Andrew Lansley and David Cameron going out and trying to present a united front, and they'll put a bit more flesh on the bones about what sort of changes might be in Andrew Lansley's reforms as they go forward in this, you know, after this pause that they talk about. I mean, interestingly, the Lib Dems were quite surprised. You know, they thought they had that coalition agreement, no top-down reorganisation. So when Lansley,
yeah, I seem to remember that statement.
Exactly. So I think there'll be, you know, Nick Clegg is looking for a few easy wins. He'll be desperate to try and show that this pause is something to do with him. Whether or not it is, I'm not quite so sure.
Andrew Porter and Dr. Bernath, many thanks for coming in. Much appreciated.